The Liver Disease Center at Henry Ford really functions as a very valuable resource to the entire region for the treatment of all patients with liver disease, from the most mundane to the most complex, for the education of our fellows and trainees throughout the region, and as a valuable clinical research network for patients with all forms of liver disease.
Henry Ford Liver Disease Center has really developed a multidisciplinary approach to patient care and management. This is critically important when patients come to us with very advanced liver disease or complex medical needs. This multidisciplinary team meets weekly and bi-weekly. We discuss patients individually and together as a team create a very dedicated treatment plan for that individual to optimize outcomes as well as their overall experience with the center. The Henry Ford Liver Disease Center has educated hundreds of fellows throughout the years in the art and study of hepatology. Our own program, we have 5 fellows each year that train specifically in hepatology and gastroenterology, but in addition we provide hepatology education to hundreds of outside fellows who don't have opportunity to meet with or study a liver disease with their faculty.
The surgeons at Henry Ford Hospital and the Transplant Institute work collaboratively with the hepatologists and the staff at the Liver Disease Center. We're part of the core team. Patients present to the Liver Disease Center with complex problems, quite often requiring surgery. And the surgical team would provide operations and support for conditions related to liver cancer, liver tumors, bile duct tumors, portal hypertension, and liver transplantation, including living donor liver transplants. The collaborative support and work in teams with the hepatologists also involves reaching out to the clinics that are throughout the state of Michigan. So together we have surgical and medical clinics where we address complex problems at the same time and provide solutions to patients living in those areas.
At any given time, we have over 30 clinical trials ongoing that offer patients cutting-edge therapy to all forms of liver disease. It's really hard to describe how remarkable the Henry Ford Research Institute functions. We have at our disposal epidemiologists, biostatistician, an entire network of researchers who are there to help us perform clinical research.
CHeCS is an acronym. It stands for the Chronic Hepatitis Cohort Study. It's a large cohort of people who have been diagnosed with either hepatitis B or hepatitis C. We pick up patients at the point they're initially diagnosed, and then we track them forward over time to learn whether they are referred or not to specialty treatment, whether they are treated, how they're treated, and what happens to them after that.
When people need to know how many current hepatitis C patients are at high priority for receiving immediate treatment, we use the CHeCS data to figure that out for the nation. Without the great collaboration between CDC and Henry Ford, we would not be able to do this large, complicated, very intense study of thousands, tens of thousands of people over a prolonged period of time.
We were an integral site at the development of transient elastography, which is now known as FibroScan. Many years ago, this was considered an experimental device, and it has now become FDA approved and has largely replaced the more invasive liver biopsy in many cases. It's been an exciting period to be involved in clinical research in the field of liver disease. At the Henry Ford Liver Center, we were involved in the development of these all-oral antivirals for the treatment of hepatitis C to effect a cure, and now these new therapies have essentially become the standard of care. Dr. Agbomo had severe fibrosing cholestatic hepatitis and was near death. The research team at the Henry Ford Liver Center requested emergency use approval of the new all-oral antivirals. He was cured and later shared his remarkable story before the FDA.
It's not just one individual, the whole process of getting me back to health, was done by a group of people. There were some people behind the scene that up to today I don't know their faces, but I did benefit, from their good work, their commitment, and their compassion, and their willingness, to save one life, out of so many, who have passed through, here. And I'm very sure, that since my situation occurred, they have also done, similar things, for other patients. So it is not just one individual, it's a group of individuals who have made it possible for me to have a second, chance at life.